As we know, mental health is a huge crisis facing our country, particularly in Ontario, across campuses. However, there are some communities, including this one, who don't talk about mental health as much as they should. I think many of us can agree that a one-size-fits-all approach, particularly to something like mental health care, doesn't always work. So how do you kind of address those challenges that are very specific to certain communities?
Yeah. So it's interesting. I was just at the Muslim Welfare Center for Project Ramadan. We were packing food bags for people in need, and I was talking to a young woman who is doing a project specifically going into schools and working with young people, helping them understand how to identify mental health challenges, and so I think that we have to have targeted responses. I also met at a South Asian at the IFSA, the film festival, South Asian Film Festival gala the other night, a woman who is working through CAMH, through the mental health care center with the South Asian community to develop strategies to help people to have these conversations. So we're putting in place $1.2 billion for increased mental health support. So increased counselors, increased psychiatrists, mental health hubs for young people, more supports in schools, so preventative measures. And many of those resources will be targeted at particular communities where there's much more of a stigma. I mean, the reality is we've had a stigma for years in this country and in this province for anybody to talk about mental health. I mean, 30 years ago, there wouldn't have been the same conversation about mental health, but awareness has been raised. But you are right, there are specific communities that need more support, so we're targeting resources and working with agencies to come up with strategies to allow men and women and children in specific communities to find their way into the services.